Hello everyone, my name is Faiza Tazi, and today I'll be presenting our paper titled We Have No Security Concerns, Understanding the Privacy Security Nexus in Telehealth for Audiologists and Speech-Language Pathologists. So audiologists and SLPs face unique challenges in telehealth, including technology barriers, confidentiality, and privacy concerns, as well as licensure and reimbursement challenges. This study identifies some of these challenges and investigates the privacy and security practices, attitudes, and measures perceived by audiologists and SLPs in private practice settings regarding telehealth. So, throughout our research, we answer three research questions. First one, how much do audiologists and SLPs practicing in private healthcare facilities understand privacy and security issues related to telehealth? What strategies and practices do audiologists and SLPs employ in the realm of privacy and security when integrating telehealth technologies into their clinical workflows challenged by resource constraints? And what emergent challenges related to privacy and security are perceived by these professionals? And finally, how do audiologists and SLPs in private healthcare settings actively institute measures to protect the privacy and security of sensitive patient data when utilizing telehealth technologies? So for our study, we recruited 20 participants, including 10 SLPs and 10 audiologists. We conducted our interviews over a period of 6 months, and each interview lasted on average 45 minutes. We then transcribed our interviews, and two researchers independently conducted thematic analysis on all the anonymized transcripts. So in the upcoming slides, we will discuss results pertaining to our 5 main themes. First one is patient data collection and identity verification processes, and then provider awareness of security and privacy, data security and privacy concerns, and trust and confidence in telehealth security, and finally, patient attitudes towards security and privacy. So for data collection strategies and procedures, there were two cases. For established patients, there was a limited amount of personal information to be collected during telehealth sessions, since the providers already have their medical history from prior in-person visits. Now, for new patients, some providers collected data through either electronic forms or using administrative staff's help before the telehealth consultations. Other providers completely refused to provide telehealth services to unestablished patients. Now, we found that collecting patient data beforehand helps providers prepare for the consultation and avoid spending time gathering information during the session. So, properly verifying patient identity is crucial for maintaining privacy, security, and trust in healthcare, telehealth services. So, some providers rely on familiarity and recognizing patients from previous in-person visits, while others have formal identity verification procedures. So for provider awareness of cybersecurity and privacy, we found that many providers exhibited a lack of awareness or limited understanding of potential security concerns associated with telehealth. Some providers expressed confidence that telehealth is as secure as in-person conversations, indicating a perception that telehealth is inherently secure. While several providers admitted to not having expertise in cybersecurity, some of them exhibited a lack of awareness or limited understanding of potential security concerns associated with telehealth. On the other hand, some providers acknowledge that the inherent limitations of achieving perfect security in any digital system, recognizing that determined hackers may still find ways to breach even well-fortified systems. There was also a wide variation in the level of security knowledge and implementation among providers. Some providers took proactive measures like implementing policies, insurance, software updates, and security practices, while the lack of technical background or time constraint hindered some providers from actually fully understanding and implementing security measures. So for data security and privacy concerns, we found that some participants expressed significant concerns over the security of patient data, especially regarding vulnerable populations like older adults or children who may not fully understand data privacy risks. Other participants, however, had lower levels of concerns, either due to perceived robust security measures by their telehealth platforms or third-party providers, or a lack of previous security issues experienced. So, also, several participants expressed concerns about specific security breaches, like Zoom bombing, that occurred during the COVID-19 pandemic, despite not personally experiencing such attacks. Now, this awareness of these incidents heightened their perceptions of vulnerability. We found that other participants were actually more concerned about patients or parents recording sessions or taking control of the session than external hackers. As S6 notes, a concern that the client or the parent was going to record the session or take over the session. I think I was more concerned about those people than a cyber hacker. Other privacy concerns were raised about unintentionally capturing family members or strangers in the background during video sessions, leading to uncomfortable situation. As A2 notes, privacy is not just about the person who's on camera, but also the people who are inadvertently on camera in the background. This shows the need to implement the measures to prevent an intentional disclosure of sensitive information by participants during telehealth. So for trust and confidence in telehealth security, we found that a lot of participants trusted the security decisions made by their organizations or leadership teams, believing that the implemented measures were compliant with HIPAA requirements. Sometimes they saw the ensuring security as outside their role and trusted those responsible for making well-informed security decisions. Other participants expressed concerns over the security and privacy of specific platforms, like Zoom, citing some issues like encryption or even lack of transparency about security protocols. On the other spectrum, we found that some participants exhibited significant trust in their software providers, which grew over time as they experienced smooth functionality and an absence of technical issues. Sometimes established reputation, perceived emphasis on security, and even a get what you pay for mindset contributed to the trust in certain providers. Now, we also asked our participants if their patients have ever expressed any concerns regarding telehealth. Some observed that their patients prioritize the convenience and user-friendliness of telehealth services over any concerns about security and privacy. Some patients were more focused on accessibility and effectively addressing their health issues rather than considering data privacy and security aspects. There was also a lack of patient awareness or engagement with the security and privacy aspects of telehealth, suggesting a potential knowledge gap or lack of prioritization on the patient side. On the other hand, there were some patients who expressed concerns about the potential recording of sensitive conversations or data logging during telehealth sessions, highlighting some anxieties relating to confidentiality. In some cases, patients chose telehealth services as a means to maintain privacy and confidentiality, actually, avoiding in-person appointments that could potentially disclose their conditions. We also did a short comparative study between the audiologists and SLPs and found three main themes. First one is patient demographics, variation in cybersecurity awareness, and perceived sensitivity of information. So, a significant portion of audiologists reported having older adult patients, while most SLPs stated they primarily treated younger patients. This demographic difference influenced the adoption and acceptance of telehealth services, which led to different challenges faced by each demographic. Audiologists highlighted challenges their older adult patients faced in adjusting to digital platforms and telehealth services, such as technological literacy and lack of necessary devices. Now, SLPs emphasize difficulties uh, encountered in telehealth sessions with younger children, with parents expressing dissatisfaction with the efficacy and progress made through virtual therapy sessions. So, a comparatively higher awareness of cybersecurity risks was observed among audiologists. This is possibly due to the unique challenges they face working with older adults who are less familiar with digital tools. However, some participants from both groups expressed lower concerns about cybersecurity, assuming their work did not involve sensitive information or even psychotherapy. Now, we found a similarity between SLPs and audiologists in the general perception of information. So participants' perspectives on cybersecurity were influenced by the perceived sensitivity of the information they handled in their respective personal professional domains. There was also a tendency to underestimate security threats when dealing with seemingly non-sensitive information. An example of that is a statement by S10. So for most of the students I work with, it's mild to moderate articulation or stuttering. I'm not doing like psychotherapy. Or another statement by A8, if I were in a different kind of healthcare, then I could see maybe some concerns that the kind of stuff I deal with is out in the open. Um, so I'll move on to implications, but I'll try to be brief, just to take into consideration our time constraints. So telehealth offers flexibility and convenience for both patients and practitioners, but the very flexibility that makes telehealth appealing also introduces several security and privacy challenges. We also provided some recommendations for telehealth service providers and software vendors. Some of these recommendations include engaging with industry experts and practitioners to develop specialized guidelines tailored to address unique challenges faced in telehealth settings, or building applications with security in mind, and obviously balancing usability and security, as well as providing interactive training and best practices. So, training is also paramount for compliance efforts in healthcare, including compliance with HIPAA. However, participants demonstrated limited awareness of HIPAA requirements and variations, especially for telehealth. So, as such, many participants noted there is a need for specialized telehealth security training. And given the constantly evolving cyber threat landscape, instituting telehealth security training as a mandatory requirement can be essential. So, some of the concerns our participants had for their patients include patients accessing telehealth services from uncontrolled environments, which can lead to some security vulnerabilities that can be challenging to circumvent. And also, it can be difficult for consent documents alone to actually strengthen security and privacy in real-world applications. As such, it is necessary to actually provide tailored education resources for patients. We have also made some policy recommendations, but given that our study was US based, I'm only going to talk about HIPAA. So HIPAA has been a cornerstone for healthcare in the US, but the, the advent of healthcare demands specific refinements. So integrating more explicit telehealth-centric clauses can enhance HIPAA's efficacy in the context of virtual care. Also, some detailed guidelines are needed for recommended practices around virtual patient interactions, visual privacy, session confidentiality, and secure communication channels. Thank you for listening.